Is your HbA1c higher than you'd like? You're not alone, and there are evidence-based steps you can take, whether you're in the prediabetes range, sometimes called non-diabetic hyperglycemia, or you've recently been diagnosed with type 2 diabetes. Understanding what this number means and what can genuinely influence it is a really important starting point. So, what exactly is HbA1c? It stands for glycated hemoglobin. When glucose circulates in your bloodstream, it binds to hemoglobin, the protein inside your red blood cells. Because red blood cells live for around 120 days, your HbA1c gives a reliable picture of your average blood glucose over roughly the past 8 to 12 weeks. That's what makes it such a useful long-term marker. In the UK, HbA1c is measured in millimoles per mole. According to NICE guidelines, below 42 is normal. 42 to 47 suggests prediabetes, and 48 or above can indicate type 2 diabetes. One thing worth knowing, HbA1c isn't reliable for everyone. It can give inaccurate results in people with certain hemoglobin disorders, conditions that affect red blood cell turnover, chronic kidney disease, or during pregnancy. Your GP can advise on the right tests for your situation. Now, let's talk about what the evidence actually supports. Diet is one of the most powerful levers you have. Diabetes UK backs both low carbohydrate and Mediterranean-style eating patterns for improving glycemic control. In practical terms, that means reducing refined carbohydrates, things like white bread, sugary drinks, and processed snacks, and increasing fiber from vegetables, pulses, whole grains, and nuts. These changes help slow glucose absorption and reduce the sharp rises in blood sugar that push HbA1c higher over time. Physical activity is equally important. Current guidance recommends at least 150 minutes of moderate intensity aerobic exercise per week. Brisk walking, cycling, or swimming all count. Adding twice weekly resistance training, such as bodyweight exercises or weights, further improves insulin sensitivity. Both types of exercise help your body use glucose more effectively. Beyond diet and exercise, there are lifestyle factors that are often overlooked. Poor sleep and chronic stress raise blood glucose through cortisol and other stress hormones, so addressing these genuinely supports your HbA1c, not just your general well-being. Heavy alcohol use can also raise blood glucose, but there's an important nuance here. Alcohol can cause delayed low blood sugar, particularly if you use insulin or sulfonylureas. If that applies to you, speak to your diabetes team about staying safe. One critical safety point: if you're taking an SGLT2 inhibitor, a type of diabetes medication, you must not start a ketogenic or very low carbohydrate diet without speaking to your doctor first. The MHRA has warned that this combination carries a risk of diabetic ketoacidosis, which is a serious condition. In terms of timescales, measurable reductions in HbA1c can typically be seen within 8 to 12 weeks of consistent lifestyle changes. That's how long it takes for red blood cells to turn over and for the test to reflect your recent glucose levels. So if you've recently made changes, give it time and make sure you have a follow-up test booked. If your HbA1c remains elevated after 3 to 6 months of genuine lifestyle changes, that's a clear signal to go back to your GP. Medication or additional support may be appropriate. And if you ever experience symptoms that could suggest diabetic ketoacidosis, such as nausea, vomiting, abdominal pain, or unusual breathlessness, or signs of severe hypoglycemia, please seek medical attention without delay. To recap, HbA1c reflects your average blood glucose over roughly 8 to 12 weeks. Evidence-based lifestyle changes, a lower glycemic or Mediterranean-style diet, regular aerobic and resistance exercise, better sleep, and stress management can produce clinically meaningful reductions. And if you're on certain diabetes medications, always check with your doctor before making significant dietary changes. This video is for general information only and is not a substitute for personalized medical advice. Please speak to your GP or diabetes care team about your own results and circumstances. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, Please like this video and subscribe to the Bolt Pharmacy channel for more evidence-based health content.